Everybody knows that the medical system and the medical center serve as UMB's key platform for training the future providers of care in Maryland. Now, all of you certainly know how closely our School of Medicine works with the hospital. Critical relationship, wonderful relationship. But I should say that our partnership is broader than that. It extends to our School of Pharmacy, where a joint residency program prepares pharmacy graduates who want to work with patients in a hospital setting. And I'm just giving examples, there are many. Our School of Dentistry, where pediatric dental residents are on call 24/7 for children who need emergency care at the medical center. The School of Nursing, where a nurse-managed urgent care center was recently opened to alleviate long wait times in the hospital's emergency department. School of Social Work, which provides staff to the system's provider networks so that patients can access the services they need to get and stay well. And this partnership also extends, I'm very proud to say, to our critical work in the local community. We've joined forces with the medical center to improve health, education, and economic development in West Baltimore, knowing that if we work together, we can be an even stronger ally for our neighbors who need us.
When we look at the medical system, I'll often say, read the name, University of Maryland Medical System. Our relationship with UMB and the School of Medicine is defining in who we are, and I think just provides us, as we compete in the Maryland healthcare marketplace, with a huge competitive advantage. And as you know, we have a new medical system brand message, be a part of something greater. And I think in many ways this showcases what the medical system is all about. It is very large, it is statewide, and together, when you add the parts together, the whole is much bigger than the individual parts. So 25,000 employees, so it is truly a great asset for the state. But our medical system is, of course, very Maryland-focused, and I think that differentiates us from Johns Hopkins and MedStar. When the day is done, we are all about the state of Maryland. We have over 150 service locations across the state, and we're out there and are totally committed to what's best for the people of Maryland.
People think of anchor institutions and they think of companies like Under Armour, or companies like McCormick, or companies like T. Rowe Price or Legg Mason. And all of those, I think, are fine examples of anchor institutions. And in healthcare, again, I would argue that oftentimes people think of two institutions as anchor institutions in the healthcare space of our community. One institution I continually somehow can't remember the name of, but I know it's located somewhere not too far from us. The other is the University of Maryland. We are collectively an anchor institution in our community, and if you think about what it means to be an anchor institution, historically in healthcare, we may have mistakenly believed that to be an anchor institution, you have to deliver amazing care to people when they come to your doors. And the truth is, the definition of an anchor institution are organizations that connect to the community in a deep and meaningful way that goes beyond just the primary mission of why we exist. And so when you think of our partnership with UMB, I would hope that our partners at UMB across the campus would say that we at the medical center and across the system are assuming the responsibilities that are associated with being an anchor institution and connecting to our communities in very meaningful ways. And so when we talk together about this campaign of being part of something greater, I think you can expand that to whether we're talking about the system, whether we're talking about our relationship with the campus. Most importantly, what we're talking about is our collective commitment to the community that we serve.